Total duration of pregnancy is, the correct answer is option B, 280 days. Pregnancy normally lasts 40 weeks from last menstrual period, that is 280 days. So this duration is used globally to calculate expected date of delivery. Nizel's rule helps to calculate expected delivery date. Nizel's rule calculated as last menstrual period plus 1 year, have to minus 3 months and have to add 7 days. So it gives expected date of delivery. So this gives accurate due date. Earliest presumptive sign of pregnancy. Correct answer is option B, amenorrhea. Missed period usually the first noticeable symptom of pregnancy. Quickening felt at 16 to 20 weeks. Primigravida feels at 18 to 20 weeks and multigravida feels at 16 to 18 weeks. Daily iron requirement in pregnancy 27 milligrams needed due to increased blood volume and fetal demand. Normal fetal heart rate 120 to 160 beats per minute. This is the standard normal baseline FSHR. First antenatal visit ideally at 6 to 8 weeks. Early booking ensures early detection of complications. Fundal height at 20 weeks. At umbilicus, classical clinical indicator used during antenatal checkup. Fundal height at 36 to 38 weeks. At GP sternum, fundus reaches the highest level before lightening. Most reliable clinical fetal well-being indicator. The correct option is fetal moments. Reduced moments indicate fetal hypoxia. Leading cause of maternal death. The correct answer is option B, postpartum hemorrhage. Postpartum hemorrhage causes rapid blood loss leading to shock. Most sensitive early pregnancy test. The correct answer is option B, serum beta human chorionic gonadotrophin. Detects pregnancy even before missed period. Best method to confirm gestational age early. Last menstrual period, fundal height, crown rump length by using USG, fetal moment. The correct answer is option C. CRL in first trimester is most accurate. Time for anomaly scan 18 to 22 weeks. Major structural abnormals detect easily. Recommended weight gain in pregnancy 11 to 16 kg for women with normal BMI. A danger sign of pregnancy is severe headache, indicates preeclampsia or hypertension. Safe vaccine in pregnancy TT. Only non-live vaccines are recommended. Minimum normal HB in pregnancy is 11 grams per deciliter. Below 11 grams per deciliter is considered anemia. Physiological anemia occurs due to plasma volume expansion. Dilutional effect reduces HB concentration. Best natural calcium source. Option C, milk. Milk contains highly absorbable calcium. Pica usually indicates deficiency of iron. Craving non-food items is classic anemic sign. Pica usually indicate deficiency of. Commonest early pregnancy symptom, nausea and vomiting due to high HCG levels. Goodell signs refers to. The correct answer is option B, softening of cervix. Occurs due to increased vascularity. Chadwick sign refers to. Bluish discoloration of vagina caused by increased blood flow. Hagar sign refers to. The correct answer is option B, softening of lower uterine segment. Hagar sign appears at 6 to 8 weeks. The lower uterine segment becomes soft and compressible, helps to confirm early pregnancy. Best method to assess fetal growth. The correct answer is option C, ultrasound. Ultrasound biometry gives the most accurate measurement of fetal growth compared to clinical methods. Hyperemesis gravidarum is usually seen in. At first trimester, severe mouthing occurs due to high HCG level and peak around 18 to 12 weeks of pregnancy. Hormone mainly responsible for breast enlargement in pregnancy. The correct answer is option A, estrogen. Estrogen stimulates ductal growth, progesterone aids lobar growth, but enlargement is mainly estrogen mediated. Linea nigra is caused by. The correct answer is option C, MSH stimulation. Melanocyte stimulation hormone increases pigmentation, forming the dark abdominal line linea nigra. Screening for gestational diabetes is done at 24 to 28 weeks. Insulin resistant peaks at the last second trimester. Hence, gestational diabetes screening is recommended at this time. Triple test include all except. The correct answer is option D, progesterone. Triple test include alpha fetoprotein, human chorionic gonadotrophin, and unconjugated estriol used to screen for Down syndrome. Anti-D immunoglobulin is routinely given at 28 weeks. Given to Rh negative mother at 28 weeks and again within 72 hours after delivery of an Rh positive baby. Minimum acceptable fetal movement per hour. Correct answer is option C, 6 moments. At least normal kick count, at least 10 moments in 2 hours or 3 to 6 moments in 1 hour. Physiological changes during pregnancy include all of the above: increases cardiac output, increase plasma volume, increase respiratory rate. Pregnancy is a hyperdynamic state that increases blood volume, heart rate, and respiratory changes. Painless bleeding in third trimester suggests option B, placenta previa. Placenta previa typically present with red painless vaginal bleeding. Painful bleeding in late pregnancy is characteristic of option B, abruption placenta. Abruption causes severe abdominal pain due to premature separation of the placenta. Best test to assess fetal lung maturity: CTG, LRS ratio, NST Doppler. The correct answer is option B. Lecit- Best test to assess fetal lung maturity. The correct answer is lecithin sphingomyelin ratio. Best test to assess fetal lung maturity. The correct answer is option B. Lecithin sphingomyelin ratio greater than or equal to 2 indicates mature fetal lungs. Best test to assess fetal lung maturity. The correct answer is option B. Lecithin sphingomyelin ratio more than or equal to 2 indicates mature fetal lungs. Doppler USC is mainly used to evaluate. The correct answer is option B, blood flow in vessels. It measures umbilical artery, middle cerebral artery, and uterine artery flow to detect hypoxia. First fetal part to ossify. Correct answer is option A, skull. Cranial ossification begin early 7 to 8 weeks and it first detectable on ultrasound. Most common cause of anemia in pregnancy. The correct answer is option C, iron deficiency. Increased maternal demand and how dietary intake make iron deficiency the most frequent cause. Intrauterine growth retardation commonly occurs in hypertension. IUGR commonly occurs in. The correct answer is option B, hypertension. Hypertension reduces blood flow to the placenta leading to growth reduction. Polyhydramnios is associated with. The correct answer is option A. Baby cannot swallow amniotic fluid that leads to accumulation, causes polyhydramnios. Oligohydramnios is commonly due to renal agencies. Fetal kidneys produce amniotic fluid after 20 weeks. Absence causes severe oligohydramnios. Most accurate test for gestation is. The correct answer is option C. CRL in the first trimester has less than 5 day error margin, making it the gold standard. Best supplement to prevent anemia. Correct answer is iron folic acid tablet. Iron plus folic acid corrects the prevents anemia in pregnancy. Additional protein requirement in pregnancy. The correct answer plus 25 grams per day needed for fetal growth, placenta, and maternal tissues. Normal blood pressure in pregnancy is below 140 by 90 mm of Hg. BP more than or equal to 140 by 90 is pregnancy induced hypertension. Most accurate test for detecting fetal anemia. The correct answer is option C, MCO Doppler. High MCO peak systolic velocity indicates fetal anemia. Meconium stain liquor usually suggests fetal distress. Hypoxia causes relaxation of anal sphincter, leads to baby passes meconium in utero.